Call the meeting to order. Begin with a moment of silent prayer and pledge, please. The pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And a roll call, Supervisor Schleif and Supervisor Smisek are both excused. Everyone else is here. We do have a quorum. I'll begin with the Affidavit of Posting. This is a meeting of the Washington County Board of Supervisors. Prior to this meeting, public notice was given by posting a copy of the agenda in the office of the county clerk and emailing the agenda to the West Bend Daily News, which is the official newspaper. In addition, the agenda was emailed to CNI newspapers, Express News, Kewaskum Statesman, the Milwaukee Journal Sentinel, WIBD, and WMBZ Radio, and WTKM Radio. The above action is in conformity with the state of Wisconsin's open meeting law. Before we begin with the consent agenda, I just want to make a short announcement. Friday is Employee Appreciation Dinner. As been our custom, supervisors make a donation. If you have not yet made a donation, please see Supervisor Kelling if you would like him to purchase a gift certificate from a local restaurant because they've been pretty well hard hit by the pandemic. And let him know what you want to spend on that, and he can go do that for you. If you want to contribute towards gifts, I'll be doing the run to Best Buy this year, tomorrow morning actually, when I get out of the office, and just let me know if you haven't already. Okay. Next on the agenda is consent agenda. I'll entertain a motion. Supervisor Sorcy, second Supervisor Mary. Any changes, corrections, discussion? Hearing none, all in favor, signify by saying aye. 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 Any opposed? Okay, moving on to personal appearances, letters, and other communications. Commendation of Paul Sebo from Planning and Parks Department. Come on up. Front and center. Huh? Sure.
All right, so we're going to do a commendation for Paul. I'm going to let Don make it up.
Takes me a while.
So commendation of Paul Siebel, whereas firefighting foam that contains PFAS, I'm not going to pronounce what that means. I'm not even going to try. Firefighting foam, basically, right? Yep. Constitutes a U.S. OSHA hazardous material because of its physical hazards such as skin and eye irritation. And whereas chemical-based firefighting foam has been sold for decades because of its effectiveness in extinguishing jet fuel and petroleum fires, but we are now finding that it may cause various types of cancer, including kidney, testicular, and pancreatic cancer in firefighters. And whereas recent laws prohibiting use of the foam in most cases has caused a need for safe and proper disposal of this foam, affecting all 13 Washington County fire departments. And whereas on February 14th, 2021, the Washington County Fire Chiefs Association recently commended Paul for his hard work to coordinate and execute the disposal of all PFAS foam held by our fire departments, including foam in 14 fire engines and 5-gallon pails. And whereas this type of coordinated intergovernmental collaboration is now receiving inquiries statewide as fire departments look to dispose of materials in the most cost-effective way for taxpayers. Now therefore, I, Josh Shulman, Washington County Executive, hereby commend Paul for his solution-oriented mindset and willingness to work collaboratively to solve problems, saving the taxpayer at large thousands of dollars and helping save firefighters' lives by combating cancer-causing agents. Thank you, Paul.
No, I guess the only thing I could say is thanks for the support of my managers and county exec and this board here for allowing me to do what I can do. So appreciate it, and thank you.
Thank you.
Thanks, Paul.
Thanks.
Next order of business, consideration upon request, reading of resolutions and ordinances. 2021 Resolution 1, advisory resolution supporting legislation to provide an increase in criminal and ordinance violation surcharge. I'll entertain a motion. Supervisor Marquardt, Supervisor Dice. Are there any questions regarding it? Pretty straightforward. Supervisor Krebs, hang on, let me get you on there. Okay, go ahead.
Thank you, Mr. Chairman. I understand that we're asking to increase the retained fees. What I'm not so sure if it's clear or not, are we asking for an increase in the actual charged forfeitures of $20 or the $163? I guess, are we asking to increase what they're charged, or just the amount that we're keeping of it?
I don't know, that's good. Teresa, speak to that.
Hi. So the extra $20 would be for traffic forfeitures, citations, and for criminal actions in which a fine has been ordered. Right now, the fees are at $20 for a traffic or forfeiture case and $163 court costs for a criminal matter. So it would be an additional $20 on any of those.
So we're asking. So we're looking for an increase in the actual end fine that's assessed.
Yes, by $20.
Okay.
Supervisor Gauss.
Yeah, maybe I'm confused, because that was a similar question, and it says the clerk currently only retains 9.9 of the total amount charged. This resolution supports legislation that would increase retained fees in amount of 20. So 20 total, so a 50% increase? So only a $10 increase? Is that what I'm understanding correctly? Again, I just want to make sure, are we talking about increasing the amounts that were just mentioned per criminal and per traffic, or is it the amount retained?
Can you also speak to the last time that these rates have even been looked at?
Yeah, so the, right now, the $20 for the traffic and forfeiture cases, half goes to the state and half is retained by the county. And the state looks at the half as $10.01 for them and $9.99 for us. So the $163, $153 is retained by the state and $10 is retained by the county. So what the executive is actually asking for is a $20 increase to each of those, fully retained by the county. So in addition to $9.99, there would be an additional $20 and on the traffic and forfeiture. And on the criminal case, in addition to the $163, it would be another $20. We would retain $30 then on those cases.
Thank you.
Supervisor Dice.
Thank you, Mr. Chairman. Teresa, is this something that we're doing on our own, or is this something that the State Association of the Clerk of Courts is endorsing or seeking?
This originated actually in Sheboygan County. Senator Lemieux, who's the Senate Majority Leader, was presented this information on behalf of their county. It was introduced to us through them. I shared it with Teresa as one idea that we might be able to do, and that's where it came from. So I can't speak to whether the association is endorsing it or not, but that's the path it's taken thus far.
Okay, so it's just Sheboygan and Washington counties that are pursuing this at this point?
I am not aware of the Wisconsin County Clerk of Courts Association being aware of this even.
Is this something that you might want to bring up to them?
Well, If the county board approves this will be brought up at the Wisconsin Clerk of Courts Association. It did start with Sheboygan County sharing information with the other counties. So the other clerks, I'm not sure how aware they are of it, to be honest. So.
Okay, so this is increasing the total amount of whatever the forfeiture or the fine is, correct?
That is correct.
All right. So has there been any discussion of maybe saying to the state, you take less and give us more?
So when Josh brought this information
that's
to
a
me,
great
I
idea
did
myself,
analyze
but-
all of the information Sheboygan County provided to us. And I just was completely honest with Josh that I don't see that happening.
I
The
suppose.
county the county used to get $10 out of the $20, and then when they raised it to 163, they took that extra penny away. So I'm not imagining that they're going to share.
They have a great track record of sharing.
Yeah. I just throw that out there since the public is listening to this and sometimes they need to understand
Well,
how.
if the person you're sitting next to ever sits next to anyone else who may know things of this variety, they might want to mention such things.
I haven't read the whole book. Okay, thank you.
Yeah, there's a number of fees that the state collects through cellular phone charges, I think of some of the other ones, where they're supposed to dictate those funding back to the municipalities, and they don't do that either. So having the state give up any of their claim to any of our funds that should be going to local municipalities is probably slim and none. So Supervisor Bossert.
Just real quick, I want to note, you might see in the resolution, the last time this fee went up was 1991. That's 30 years ago. If you think about our costs that we incur over 30 years, pay rates have gone up a lot over 30 years. The cost of health insurance and other benefits have gone up. I think it's reasonable that if somebody's convicted of a crime, that they should pay a portion of the costs that we incur in order to basically prosecute them.
Agreed.
Thank you.
Thank you. Supervisor Gallus? You turn yourself off, hang on, there you are.
Yeah, thank you. I guess it's along the lines of Supervisor Bossert, is how did we come up with the $20? Is it to stem a loss of revenue and we have expenses? Is it matching expenses? Just trying to understand, where did the $20 come from? Yep. Because if we have these unfunded mandates, whatever you want to call it, and throughout this evening, we have other resolutions about levies or non-levies, and so if we're unfunded, how do we come up with $20? Or underfunded, I should say.
$20 was simply what Sheboygan County was using, and Senator Lemahue had heard about it already, so we just took their lead. I mean, you could probably make it $200 and they still wouldn't pay the fair share of the state court that runs in a county building. But it really honestly could be any number.
Yeah, and this is an advisory resolution, so that they would support that to happen in the state. So it's not a slam dunk that the state's even going to look at it and approve it. So it's just we're just supporting that increase. That's what the vote would be about. Supervisor Krebs.
Do we have any idea of what the state uses their portion of the forfeitures for? Like the $153 or the $10.01?
I do not. I don't know.
Thank you.
Do you want to buzz me in, Don,
so I
can answer that? So my understanding is that the state pays all the costs for operating the 4 circuit courts. So the judges' salaries, all of their staff salaries. The state also pays the district attorneys that pays all of their salaries and all the costs for their office. So the state portion, that's what they're using that to cover, is their expenses related to prosecuting criminals. And I believe, and correct me if I'm wrong on any of this, that we fund the clerk of court's office, and that's where we incur expenses. Is that all correct? Yep.
Yes, that is correct, that the state does pay the salary of the judges and the court reporters. The county is responsible for the county employees. And any other expenses incurred for running a court system, such as paper, supplies, yeah, security, yeah, things like that.
Thank you. Seeing no further discussion, and we'll vote on this electronically. Motion passes 23-1. 2020 Resolution 2, advisory resolution supporting legislation to remove requirement for duplicate copies of a transcript for application of a search warrant. And I'll let Teresa handle that one also. Oh, I'm sorry. Motion, Supervisor Gonring, Supervisor Bossert. Thank you.
Okay, so this resolution is regarding search warrants. So the procedure right now is the judges, after business hours, may get a search warrant that a law enforcement officer needs for them to sign. And what happens is, this is all done electronically, so the judge would be at home, they would receive a search warrant electronically, and they would reach out to the dispatch at the sheriff's department on a recorded line. And when this communication is going back and forth, they are being recorded, and in the morning, the sheriff's department provides the clerk of court's office with a CD. Actually, they provide the judge with a CD. And the CD has the voice recording on it, and the judge has their court reporter transcribe this. So right now, the statute says that, excuse me, says if the testimony was recorded by means of voice recording device, the judge shall also file the original recording with the court. So we have other parts of the Supreme Court rules that actually say the verbatim record is intended to assist in the preparation of a transcript, and the transcript and not the verbatim record is the official record of the proceedings. So this is under Supreme Court Rule 71.03 sub 2. And so since the transcript is filed in my office and the verbatim record or that recording is no longer necessary, it's not even considered part of the official record, it's a little bit different than the steno notes that a court reporter has when she is taking notes during a court day. So when she's in court and she is she's taking care of the record for that day. She might have a criminal case, she might have a family case, she might have all different matters that the judge is hearing for themselves. And so all of that is being saved on steno notes. And we don't ever really know when those notes are going to be needed for a transcription. So those records are kept for 10 years, and that's under a Supreme Court Rule 72.01 sub 47. And those are retained for up to 10 years. But when you look at these search warrant recordings, they're transcribed immediately. So that's the official record. There really is no reason for us to have to maintain these CDs for any period of time because that transcribed record is actually filed in my office and is part of the official record. So that's what we're asking for, is to have that one sentence removed from the statutes. And you may or may not be aware, but Assembly Bill 84 and Senate Bill 66 also address this issue, and we're just looking for your support for that.
Supervisor Guzzi.
Thank you. Just for education purposes, if you could go into a little bit further for me in regards to these voice recordings. First off, has there ever been a need to actually go back to use these at all throughout history? If for purposes of not being able to find paper recordings for some reason?
Once it's filed in my office, it's considered the official record. We don't destroy those records until the retention period has passed, and that is also set by the Supreme Court. But knowing that this is an official record, the transcribed recording, there is absolutely no need to go back to that CD.
Okay. And then again, for education purposes, how are these said voice transcriptions, the CDs, destroyed then?
Well, if that sentence is removed, then the judge or the court reporter, they would work out however they want to have those destroyed. They can simply be just destroyed through a shredder.
Okay.
So
There's no official, like, security reason it would need to be done a specific way?
I'm not aware,
Okay. Okay.
no.
Thank you.
Supervisor Bossert.
All right, I want to throw out a quick thank you to our Assembly Representative, Rick Gundrum, who introduced this into the Assembly. He also happens to be a previous county board chair for our county, so want to thank him. I want to make sure everybody knows that, and this comes courtesy of Mr. Eberly, who got this to me today, that the Senate has already passed their bill on this. The Assembly is holding a committee hearing tomorrow in the Assembly Judiciary Committee, and hopefully the Assembly will pass this and get this to the governor so that he can sign it, and we can be more efficient and not wasting resources storing things that we don't need to store anymore. Thank you.
Thank you. Seeing no further discussion, we'll vote on this electronically. Did you want to speak, Carol? Did you want to speak? Okay. Double click yourself off then. So. Motion passes unanimously. 2021 Resolution 3, request public hearing for discontinuance of lands held for highway purposes known as County Trunk Highway D in the town of Wayne. Take a motion, Supervisor Bishop, Supervisor Guzzi. Is there any questions? Seeing no questions, we can also vote on this electronically. Motion passes unanimously. 2021 Resolution 4, authorize sale of excess right-of-way to a budding landowner. Supervisor Mary and Supervisor Sorcy. Are there any questions regarding this? Do we need an explanation? Okay, seeing none, we'll vote on this electronically. Motion passes unanimously. 2020 Resolution 5, resolution supporting concept of continuing long-term care for Washington County residents. Supervisor Hartwig, Supervisor Gonring. I know there's going to be questions on this one, right? Supervisor Dice.
Thank you, Mr. Chairman. I do not have any questions, but I want to reiterate what I put in my report to the county board that was contained with the other papers we received for tonight's meeting. And that is that this is probably going to be the first of maybe a few other decisions we have to make about Samaritan. And it's probably one of the most important decisions that we're going to be making tonight on this issue, because we're being asked to agree with the task force that was set up to continue what we have for many, many years, and that is by having long-term nursing care for our citizens who do not have private insurance, who are in need of a place, who are in need of care. There's a lot to be said on this topic. I'm hoping that all of you had a chance to watch the hearings of the task force on YouTube. Thank goodness for technology that came in handy with this issue. I will again state that the Human Services Committee approved this unanimously, so please take that into consideration when you vote. We've been in this business, and I think morally we need to continue in this business. But with the added important part that we use and spend the taxpayer dollars wisely. So with that, I believe, Paul, you're going to take over, right?
Yes, thank you.
So I will be quiet now, for now.
Well, good evening. My name is Paul Roback. I work for UW-Madison Division of Extension, Washington County. And the mission of Extension is to fulfill what's known as the Wisconsin idea, that the boundaries of the university are the boundaries of the state of Wisconsin. And through our partnerships with county government, we deliver our educational programs from border to border throughout the state. As the community development educator, I provide education primarily to nonprofits and local governments, including the Washington County Board, as well as all the departments. I was asked by Matt Furno to facilitate the Samaritan Task Force process. So my specific roles were helping designing the process, facilitating meetings, helping arrange speakers, writing the report of the task force recommendation, presenting the recommendation to the Human Services Committee, and then presenting it to the CB as well. A brief history of Samaritan, as you're probably well aware of this information already, but for those that are listening in who may not be aware of this subject as you all are, the nursing home opened in 1968 with a capacity of over 300 residents and was renovated in 2009. The Fields opened up in 2006, which expanded long-term care offerings to include assisted living. Assisted living includes both the CBRF, the community-based residential facilities, and the RCAC, the residential care apartment complexes. Current campus accommodations include 131 skilled nursing residents, 31 CBRF residents, and 24 RCAC residents. And for primarily the rest of this presentation, I'm just going to refer to CBRF and RCAC as assisted living, just to help the process along in our understanding. Now, last August, you received a presentation by Whitfley, Patrick Carroll and Larry Lester. They're both here this evening to answer questions, to help answer questions later on if needed. And what they provided was a market and financial analysis of the Samaritan campus. And as you know, for many years, nursing home reimbursement rates have not kept up with costs. And this current Samaritan nursing home requires millions in renovations. At the conclusion of that presentation, the county executive recommended as a next step the formation of the Samaritan Task Force. Through the county executive proclamation, the task force was created, recommending the policy questions: should Washington County remain in long-term care nursing home services? So this is a should question. Should the county remain in nursing home services? Not how should the county necessarily be providing it. Although it's really difficult to separate the how the county should be doing it from whether or not the county should be doing it. And I'll get into a little bit more of that later in the presentation. And this is a non-binding recommendation to the Human Services Committee and then to all of you. The proclamation also detailed out who should be on the task force. And I'll just briefly read through this. The task force may include 4 business or nonprofit leaders, of which 1 may be a resident or family member of a resident of a senior living facility. 1 may be affiliated with long-term care industry. 1 may work in the healthcare industry. 1 may be a current retired direct care worker of a long-term care facility, and up to 2 additional public members. With that, we have the 7 members of the task force on the screen in front of you, including Deb Anderson, who's with us this evening. Deb is retired. She's been involved with several long-term care organizations and is current board member of Senior Citizens Activities Incorporated, commonly referred to as the West Bend Senior Center. Not only that, but Deb was previous executive director of that organization. Nick Bush works for Direct Supply Brands. If you're not familiar with that business, they develop products and solutions for senior living industry, including skilled nursing and assisted living facilities. Dell Ellefson is retired registered nurse and past owner and operator of assisting living facilities here in Washington County. Jason Hartland, Chief Revenue Officer of the Milwaukee Brewers Baseball Club. Donna Nash is our Vice Chair of the task force. She is also with us this evening and will be saying a few words later. She works for Workforce Health, which is part of Froedtert and the Medical College of Wisconsin, and they do workplace wellness, workplace clinics, operational health services, and customizable health solutions. Next on the list is Craig Sadanago, who many, if not all of you know, as the former mayor of City West Bend and president of American Companies. He was unable to be with us this evening. He did present to the Human Services Committee when they met just a few weeks ago. And then also Gina Whitney is with us this evening as well. She's works for Principal Financial Group and is a family member of a current Samaritan resident. Of that 7 members of the task force, all of them are Washington County residents. 2 reside in Germantown, 1 in the town of Erin, 1 in Slinger, 2 in West Bend, and 1 in Allenton. So nice geographic dispersion across the county. So the task force met 3 times in 5 weeks, so it was a pretty aggressive timeline. The first meeting on February 1st, they received the same information that you received back in August. So the same presentations. Mary Beth, the campus administrator for Samaritan, presented on the history of Samaritan, the overview of operations, and the physical conditions of the campus. Julie Driscoll from Health and Human Services presented on protective placement, commonly referred to as Chapter 55. And then Patrick Carroll and Larry Lester presented the financial and market analysis and future projections. So again, all the same presentations and content that you heard back in August. The February 22nd meeting had a lot more information, kind of information overload in these first 2 meetings with a lot of presentations. And the first 2 were from the Wisconsin Department of Health and Human Services. So this is new information that has not been presented to you before, so I just thought I'd give a couple highlights from each of the presentations that were given. So Alfred Johnson, the Director of Bureau of Assisted Living, that bureau oversees CBRFs, adult family homes, RCACs, and adult daycares. And he mentioned that assisted living facilities is a fast-growing industry, and it's anticipated to continue at its fast-paced growth. Ann Angel presented trends in Wisconsin's nursing home industry. She is the Bureau Director for Nursing Home Resident Care. She presented that over the past 5 years, 45 facilities have closed in the state of Wisconsin, and that the need for providing dementia care is increasing in the state. Leading Age presented trends on Wisconsin's aging population, the challenge of finding skilled long-term care workers, the growth of assisted living facilities while nursing home facilities have decreased in the state, and Medicaid's underfunding of nursing home facility residential care. The final presentation was by Brian Shanek, retired from Leading Edge. We were honored that you'd come out of retirement and present to us. And he really has a lot of experience on the implications of closing of county nursing homes in the state. There are 42 nursing homes, county nursing homes in 37 counties, representing 20% of total nursing home beds in the state of Wisconsin. Since 19
over again, those numbers?
Sure. There are 42 county nursing homes in 37 counties, which represents 20% of the total nursing home beds in the state of Wisconsin.
Thank you.
You're welcome. Since 1986, 19 county nursing homes have been sold or closed. So roughly in the last 35 years, roughly one has closed every 2 years. The third and final meeting was really a summation of all the information and data from the first two, and an opportunity to ask additional questions of all the presenters. And then we had a facilitated discussion around the question that was in the proclamation, should Washington County remain in long-term care services? And then the task force made their recommendations. Some of the considerations that the task force went through, although the county is not mandated to provide long-term care services, it has provided these services for over a century. The county is statutorily required to provide emergency protective placement, which is the Chapter 55s. In 2020, the county had 28 Chapter 55s. Of those, 10 were placed at Samaritan for a total of 631 bed days. Most of those can be billed to insurance for the cost of the stay. If these admissions were placed in another facility, it could have equated to an additional $258,000 expense to the county. Samaritan is the only facility in Washington County that accepts Chapter 55s. As you've heard, current Samaritan nursing home has a lot of facility needs. In fact, $5 million of improvements are needed over the next 5 years. And even if the county made that investment, you would still be left with an old and somewhat antiquated facility. The status quo financial model identifies a projected deficit of nearly $1 million in operations by 2025. And this is largely due to the assumptions of 4% increase in salary and benefits versus an annual 1.5% increase in revenue from Medicaid and family care. Constructing a new facility is estimated to cost between $20 and $25 million, and the county is currently exploring a partnership with a third-party provider that may result in updated facilities and a lower operating cost from shared services. With those considerations came really 3 alternatives that were considered by the task force. The status quo is not an option. They decided because of the age of the facility and the maintenance needs. A new facility may not be financially acceptable, and a third-party provider partnership may be the proper balance between financial and moral obligations. And moral obligations are loosely defined as providing safety net services for those who are most vulnerable in the county. With those considerations and alternatives, the task force made the following recommendation: that the county board continue to provide long-term care services while balancing the financial and moral obligations through a partnership with a third-party provider with up to $500,000 in annual levy support over a 20 to 30-year lease. Underlined continues to provide long-term care services. That really gets to the should question. Again, that was in the proclamation. The remainder of it really gets to the how the county can go about providing these services. This recommendation was supported through consensus by 6 out of the 7 task force members. One task force member did indicate that they preferred the county not compete with the private sector, and specifically, the individual believed that the current assisted living facilities, both RCACs and the CBRFs, can handle the need in the county, whereas other task force members disagreed with this belief. This recommendation was presented to the Human Services Committee, and the Human Services Committee resolution had the following language: that the county board hereby approves the concept of the continuum of care for county residents with the preference that a public-private partnership model be utilized in the delivery of services moving forward. As you can see, this is slightly different than the task force recommendation because it includes the word preference. And that is in there to allow for a little bit more flexibility for the county in moving forward with exploring a public and private partnership. And I should have mentioned that preference was added in by the Human Services Committee, and they expressed those sentiments that I just said to you. At the conclusion of the task force, we did evaluate the process, and I included that in the presentation as well. 6 out of the 7 members completed the evaluation. All agreed or strongly agreed that their objective was clear, that the presentations informed their decision-making process. They had the opportunity to contribute to the final recommendation. One of the responses was neutral regarding whether or not participating in the task force increased their civic engagement with the county. So nobody disagreed with that statement. Participating in the task force was valuable use of our time. Everyone agreed to that. And the last one on there is reflection of when the task force met and developed their recommendation. It was kind of a brainstorming session, and as you know, at the conclusion of that, sometimes the product may not be 100% grammatically there, so we did a little bit wordsmithing afterwards, and I sent that out to the task force, and I just wanted to affirm with them that the statement truly reflected the recommendation that they had indicated, and all of them agreed or strongly agreed that that was the case. So that concludes my brief presentation of the task force process, and I'll invite Donna Nash to say a few words from her perspective of the task force and her involvement in it. So thank you. Great. I'll let you come up here because this microphone tends to work a little bit better. Thanks.
Hi, everyone. I'm Donna Nash. This is my first participation in a task force. And after what Paul reviewed with you, it was excellently run. I saw so much commitment and care, knowledge, education that was brought to us to make the right decision. As an outsider coming in and learning about this, which I had no knowledge about, and seeing the history of Samaritan, it would be easy as an outsider to come in and say, wow, that's a lot of money. Why would we keep doing this? But then when I started to learn about the history, understanding of, the changes in senior living and nursing homes, and I saw the morality of it, that part, the moral obligation, I should say. And when you weigh those things, I think ultimately what our committee decided to do is the right thing to do. We're not leaving people behind. We're caring for the people of this county. And I admire the leadership bringing a committee like this together to make this tough decision. And it really gives my faith in the county and the leadership of our county to do this, because it was an important decision, and I feel that what our committee came to was the right one. So I hope you will agree and ask questions, but I appreciate being on this committee, so thank you.
Okay, are there any questions, supervisors? Supervisor Bishop?
Just a comment. Back when I was campaigning the last time, Samaritan was always something I spoke to every single one of my constituents about. And there was an overwhelming leaning towards keeping Samaritan, that we need a place for these people to be, and discuss that it could be an increase in our taxes. And they felt that was a good use of our tax money. I didn't have a single negative about continuing Samaritan. So I just wanted to share that people out there are aware of it and they see a need for the Samaritan. So do I.
Thank you. Supervisor Mary?
Thank you, Mr. Chairman. I don't know if it was County Executive Shulman, whoever pulled together this public panel, but I think it was excellently done. I think it takes the onus off this particular body as the county board decided this is what we need to do. No, our citizens have decided for us what the recommendation should be. And I think commendations to all involved. Thank you, sir.
Thank you. Supervisor Markert.
Thank you, Mr. Chairman. I came to this body with a bit of a predisposition to address Samaritan in a different way. I felt like one of the task force members did, that we shouldn't be competing with the private sector. But I believe when we got the information on the percentages of Title 19 that we take care of, the information on what would happen to them if we got out of this business, meaning we'd be relying on other counties to take them, meaning families would have to travel further to see them. And also just, as somebody said, the moral, need to take care of our elderly. I've kind of changed my opinion, and I'll be voting for this.
Thank you. Supervisor Kelling.
Thank you, Mr. Chairman. Speaking of the moral obligation that we have to these people, understand we may be dealing with an older couple who have come near the end of their lives, and one of those, maybe they have nothing left and no family, and what are we going to do? You could end up with a situation where, say, the male is unable to care for himself, the female is not able to care for him, so he ends up in La Crosse while she lives here, because that's the only place that you could find a bed for him. And she has, of course, no way to get there. And this is a very real scenario, considering that a lot of these people are Title 19 cases. So when it comes to taking care of the people of our county, these are our people. These are the people we are charged with. I took great passion in making sure that the cemetery on the hill got taken care of. It's a county property full of bodies that probably nobody ever visits those graves ever anymore, but they're still our people. These people are here today, they're living today, and they are in need of our services. This is the moral obligation that we're talking about here, to make sure that our citizens know that if they find themselves in this type of situation, and believe me, that scenario is very common, that we are going to be there for them to take care of them. We can do this, and we will find a way. Thank you.
Thank you. Supervisor Gunrum.
I just wanted to share with this group how I came about my decision. I strongly support what the task force came up with. Initially, when we looked at the Whipfley report, my main concern was we only went out 5 years. Why didn't they go further? Are we going to have enough capacity to care for those that will have the need? Because currently we have 70 people. We were looking at downsizing. But in the end, we're looking at a 20-year plan. If you were to build a brand-new building at $20 to $25 million, most people go into a nursing home when they're 85 years or older. I did a little projection out of my own, and it seemed to me that along with the information that, I'm trying to think what his name is here, that we received at the Human Services meeting, that there definitely was going to be enough capacity to take care of the people in our county that are going to need the services. We currently have overcapacity, and not just here at the Samaritan, but throughout the county. So there certainly will be
other facilities that may come into caring for some of the elderly. A lot of private pay is going to be out there. We're really looking at those that don't have the wherewithal to pay. And I agree with what Supervisor Kelling said. We have an obligation to our elderly, and $500,000 a year in our budget is really nothing. I think that we certainly have an obligation to our elderly for that minimum amount, and maybe more, because as time goes on, things will be changing. I think Matt Furno pointed out that he thinks that there will be improvement in reimbursement rates as people are healthier, they stay in their homes for a longer period of time. And that's the one thing that I was mostly concerned about is, are we really going to have enough space for the people in the county? And I came away satisfied after our discussions that we were going to be able to meet the need. So that was my main concern, and I'm very satisfied with the decision. Thank you.
Thank you. Supervisor Mahalik.
Thank you very much, Mr. Chairman. This is obviously more than a computational or numbers decision. And the frustration that I have is that this problem does not exist in Washington County or the state of Wisconsin. This is a national problem that is going to balloon. In fact, it's already started ballooning to an incredible degree, and will continue to do so. We currently have a government in Washington which is willing to print money for just about anything. This is actually what they should be printing money for, because this truly is going to be $1 trillion problem. It's incredible when you look at the numbers across the country as to what it's going to cost for our elderly with dementia care, with Alzheimer's, with just getting too old to take care of yourself, and without enough insurance in place. It staggers the mind, because we have medical advances that keep people alive, into over 100 years old. And what are you going to do with these people when they run out of money? And this is the problem, as mentioned by several folks, as regards to a moral thing. The concern, of course, that I have, if you boil it back down to the county, is and I don't know if this is going to be addressed or how it is, we have a county just to the south of us that several decades ago made the decision to just walk away and close their facility. And the problem, of course, with that is that if they have somebody that's going to have a need, they can move them up here for a little while, and then all of a sudden, the county of Washington, our wonderful county, ends up picking up the tab for somebody that's lived here for a very short period of time. And that is not, I think, fair, which is why I think this is a statewide problem, at least, if not a federal problem. That's where it really, truly needs to be addressed, because we have a real problem here that we're kind of dancing around, and that is the country's either lack of will, inability, or just ignorance of this problem and how they're going to move forward on it. That being said, in some of the numbers that have gone out, I mean, it's that were stated in this, $10,500 a month to stay at Samaritan. That is not a small number. Obviously, compare it to rent, it's about 10 times the rent of an average apartment. And obviously, it's worth it to those individuals because of the services that are provided, and I understand that. Also, the number here, $3,000 a day, if you have one of these, the 55 folks that you were talking about before, is $3,000 a day in a hospital. So you're not talking $10,000 a month, you're talking $90,000 a month if they were actually going to stay there. And unfortunately, the taxpayers of Washington County have to pick up that tab. Which is extraordinarily unfortunate as regards to the financial burden, but somebody has to step up and do it. If we look with the numbers, which I asked you to repeat, and thank you very much for, I mean, you've got 42 county facilities in 37 counties having 20%, 37 counties. There are 72 counties. We're on the other side of the ledger. We are providing that service that other counties can use us to put it on. And of course, the burden is not state funding because of the lack of dollar that come from the state and federal government for reimbursement. Our taxpayers are literally forced, if you will, because of our good Samaritan-ness, if you will, to make sure that these people have a place to stay regardless, unfortunately, if they live in Washington County or not. We're taking care of more than just Washington County. So when looking all of that, and in looking at all of the numbers, when you add it all up, especially the number with that Paul brought up, which, you know, over the last 35 years, 19 have closed, so once every 2 years, you know, we're seeing another one close. I'm very much for moving forward with something like this, because again, doing the math, you're saying up to $25 million to build a new facility. But if you take $500,000 over the 30 years that we're projecting out, that's $15 million. So when you look at it, it is a real savings, if you will, but it's a savings with a heart. We cannot, as Washington County, fix this problem. We can't. I like the fact that we're looking at putting the private sector in, but this is a problem that is going to get worse and worse and worse. And with what Supervisor Gundrum brought up, is you know, saying that there's probably going to be no or more money into it. Frankly, and I know what, Marcy, you know, what you brought up as far as the possibility with taxes, I don't want to have to raise taxes for this. I really don't. This gives us the opportunity to make a real step forward and allow the people who are really responsible for this, which is the federal government, in taking this up and making sure that we have this spread out so richer counties don't take care of theirs and poorer counties are subject to something else. I mean, you've got about 3,033 counties across the United States, and it's ridiculous that these types of problems are being forced onto county governments because state governments and federal governments aren't stepping up and printing money for this rather than the crap they're printing it for now. My personal opinion. Thank you very much.
Thank you.
How do you feel?
Supervisor Dice.
Thank you, Mr. Chairman. So now that Tim's off his soapbox, I just want to thank the county executive for putting together this task force. I think it was an excellent idea. The more heads that come together and listen to what the need is and listen to all the options, the better it is for everybody. So I also want to thank the task force members themselves for a job well done, and thank you for giving of your time that came up with this recommendation. It is greatly appreciated. And now the question comes for the board is how we're going to do that, how we're going to continue this. So that's going to be the next big one down the road. So please keep that in mind. Keep educating yourselves. Keep being informed on everything that has to do with Samaritan. And I encourage you to vote in favor of this resolution. Thank you.
Thank you. Supervisor Conrath.
Yeah, I would like to first begin too by saying thank you to the task force and our leadership here for creating that task force and the vision. I know it scared me initially first because I wanted to be actively involved and, you know, maybe micromanage it, but it was done very well, just the nurse and me. So congratulations and thank you. And to just, you know, I do serve on the Health and Human Services Committee, so I won't, you know, reiterate on things that my colleagues also did. But just another comment regarding the moral obligation is something to, you know, we need to think about caring for our community across the lifespan and all the money that we spend in our school systems. Why do we not, you know, look across the lifespan to our most vulnerable and the elderly? And that's where I think, you know, is one of the moral obligation needs too. And Supervisor Kelling spoke of, you know, elderly couple being, requiring these types of services, long-term care, and being placed in potentially two parts of the state. This is already occurring and has been occurring for many years. I have, my nursing career has been in acute care, and that I have seen that happen. It is a reality, or even say, counties who do not have these services, or maybe even private sector, they're full. The loved one has to go several counties away or over 100 miles away for
and then the family, for them to just stop by and visit and have lunch and stay connected with that loved one in their, you know, in their end of life is a burden, and it's causes moral distress on both sides. And regarding financially, you know, we speak of the beds going down in the nursing long-term care facilities closing. Well, one reason for that is just care has shifted. Healthcare and in regards to the acuity of where people are. You know, the ICU patients I cared for, 20 years ago are now on the floors. They don't even come into the ICU, and I'm sure people in this room too have had surgeries over the years where you would have, 20 years ago, 10 years ago, you would have been in the hospital for a couple of days or a week, like our hearts used to be, but they're out in 2 days. So they're, in the, rehab, long-term care or type facilities, or home care. Home care services are booming, but that's just another reason too why there's a decrease, if you're wondering, in the long-term care beds. Just, how we deliver healthcare has changed. And then financially too, like I just touched upon it a little bit with, loved ones maybe having to be split, or, counties away because of beds not being open. I have cared for an individual, I remember waiting 30 days for a bed to open for this specific individual. They had needed ventilator care, needed higher care, but no longer qualified for hospital care. And so that individual sat in the ICU I served for a little over 30 days, and that's taxpayer money, and that's they still got billed for ICU care. So if you're talking, taxes also, and financially, that's something to keep in mind. But thank you. This is going to impact our county for, for several years. Thank you.
Thank you. Supervisor Gals.
Thank you. And I've been listening to all the comments and reading the material, and yeah, I am struggling because the libertarian in me, the economist in me, looks at it, maybe it's not the right way to say it, but a balance sheet, right? If we have supply and demand, what's the future demand going to be? What's the supply of beds going to be? How do we effectively, efficiently respond to that? And if the healthcare, we've heard the healthcare delivery model is changing, is this a sustainable model for the future? I don't know what the right answer is. So if we build a partnership, or if we engage in a 20, 30-year partnership, and we find out 15 years in, it's not really working, are we committed to that? So I just implore us, as we look at, this partnership option, which I'm also a little struggling with the resolution because it doesn't say what that's going to be yet. There's nothing around it other than a potential $500,000 expense. That could be more. It could be $1 million. We don't know yet, right? So we can't, trying to understand what, future costs are going to be based on something that hasn't even pen to paper yet. That's why I'm struggling. So I think we need to look at options, but if we're penning ourselves in just to the private partnership, are we then hemming ourselves into that? So.
Thank you. Supervisor Krebs.
Thank you, Mr. Chairman. I'll continue those same thoughts. I'm just reading the report. The recommendation is that the county provide a long-term care through a third party with the annual levy support. But reading the resolution, it just says a preference towards a partnership. And so I'm wondering, what's the next step if this would be approved tonight? Is that starting this conversation with the private
That's when
partnership, or how far along has that already gone?
Yeah, that's the how part of it. What we're really, what we're really looking to do now is to say that should we remain in the business, first of all, Paul talked about the how, then we're gonna be discussing the how. But realistically, I'll refer to two things. Our moral obligation and the need in the community. Government is supposed to create, fill in the needs of the individuals that we serve, not the wants. We want to do the needs, and those people are in need. So I think it's important that we maintain a place for people that have no place to go. You can look back to the 2012 election when Grandma was on the wheelchair being pushed off the cliff by Paul Ryan, closing, getting out of the business. I think that's exactly what we would be doing. We'd be taking those people that are in need for the facility that don't have the wherewithal to pay for it on their own. And we would neglect our obligation to those people. So the how is going to be discussed yet. I know we are in some, did you want to speak to any more, Matt?
So the short answer is, this confirms that we're staying in the business. The next step is, there's only two options. One is we do a public-private partnership. The other is we build a new facility. And in both scenarios, we're demolishing the building that currently exists, at least the building built in the 1960s that currently exists. So there's a lot to flesh out, including we have a whole nother organization that we need to work with and confirm. Though that will come back as another public policy decision. But we can't even move to that decision until we know that we're staying in the business. If the answer to that is no, all of this is a moot point. Does that answer your question, Supervisor?
Oops, sorry.
Yes and no. Yes, it answers my question of, I understand we got to break it apart between the should we and the how, but at the same time, a vote for one doesn't, I just want to make sure it's not binding you on the second how. I reserve the right to always come back and we can start over if we're not getting the right hows that are satisfying, I guess, so.
Correct. You always do. And it's important to understand that when the word preference was added, that was the committee's choice, not the task force choice. The committee chose to put the word preference in to not hem themselves in, to use that word. So it gives more flexibility to this board. The task force did not include that word, meaning they wanted you hemmed in. But we know that once you make this decision, no task force or executive or anybody else can hem a board in. So you still have that flexibility. What we're working towards is hopefully a solution where that doesn't have to be something we contemplate. But you still have the ability potentially to go down the path of the public-private partnership. You still have the ability to build your own facility if you so choose, and you still have the ability to get out of business. All of those are still options.
Thank you.
Supervisor Grant.
Do I have to push anything? No, I guess I'm
No,
on.
you're in. Yeah.
I want to thank the task force, too, for the time and the effort and the consideration and how serious you all took this subject. I watched the videos, and I just wanted to make a comment that I totally agree with Pam, that we should look at taking care of our people from the beginning to their end, and that we do have a moral obligation to do that. And I know whenever I look at what I'm going to contribute my money to, because budget, of course, is always a concern, whether it's your budget at home or the county or whatever, money matters. And whenever I look at that, I always want to make sure that I'm helping people that really need the help. There are so many opportunities to give or support in areas where people take advantage of the situation and maybe don't really need it, and you don't know who does need it, who doesn't need it, and things like that. But in the case here, these people really need it, there's no question. And when they're 85 plus and they have no other options, I think we really do have that moral obligation to take care of them because they really are helpless. There's no question about the need. And so I think, in my mind, there's no question that we should be there. So that's all I wanted to say.
Thank you. Seeing no further discussion, going to vote on this electronically. Motion passes 24-1. Brian, are you checking? Did you want to speak? Did you want to speak? You're flashing. Okay, I'll get you off. Supervisor Kelly?
Thank you, Mr. Chairman. Just a little follow-up on that. I'm sorry it wasn't unanimous. I do respect the person who voted against it. Certainly is your position on the board. But 23, I would definitely take. With all due respect to what Mr. Shillman says about changing or doing something different, I understand his position there. However, it seems we have a very overwhelming consensus that we are going to stay in this business, and as we move forward, we need to come up with the right path and follow it together. So I think it really will help us a lot to take this with all due seriousness on each presentation that we get to try and come up with this same consensus. Too many times we end up agreeing in principle and then it starts to fall apart when the sausage is being made, if you know what I mean. So having said that, now look, we got 23 here. We're all in agreement that we want to do this pretty much. Let's move forward with that positive light in mind and take this to the next step and really try and find a way to get this done. Thank you.
Thank you. Why don't we take a 5-minute break? Okay. Okay. 2021 Resolution 6, the reauthorization of self-insurance for workers' compensation liabilities. Supervisor Mahalik, Supervisor Guzzi. Have any questions regarding this? Do we need an explanation? Seeing none, we can vote on this electronically. Motion passes unanimously. 2021 Resolution 7, advisory resolution in support of maintaining the current state imposed levy cap. Supervisor Sorcy, Supervisor Bossert. Okay, any discussion? Supervisor Bossert. Do you have 2 minutes?
I'll be quick. Oh, geez. Boy, we're mean. All right. So I made the comment at executive that when the tool you always grab is a hammer, every problem starts to look like a nail. We just got done talking about Samaritan. And in a lot of other counties, if they had free rein to raise taxes, this discussion would have looked a lot different. It would have been, let's raise taxes. Okay, yes, let's raise taxes. Okay, problem solved. Levy limits force local and county governments to look for other solutions, to look for other tools, rather than just raise taxes. And so for that reason, I would encourage everybody to vote for this. I think levy limits need to stay in place. We've done well with them. We've made responsible decisions. Counties that have not taken the steps we have, they're in trouble right now. And they need to revisit how they're approaching these problems and stop grabbing that hammer called raising taxes and look in their toolbox at what other tools they have. Thank you.
Yeah, and I think also, what, right now with the levy caps in place, borrowing rather than finding solutions has become the norm, or having, a referendum to increase taxes. But we've done it here in Washington County. We look at better ways to build a mousetrap, better ways to make those services, to find ways to do things more efficiently and better. Everybody else, all the other counties can do this. I've said it to other county chairs. They don't like to hear it, but you can make changes. We don't have to do things like we did in the 50s, and we just need more money to continue doing things the way we've always done. So, Supervisor Bishop.
I've been around for a while. Back when this was first put in place, that they put levy caps on, I was part of a group that knocked on doors down at the Capitol to get this enacted. I agree with this very much. And there are tools within the law that allows towns and counties to raise their taxes if they feel they absolutely need to get the money that they need. I don't think we should let go of the leash here. So I'm in favor of this.
Thank you. Seeing no further discussion, we'll vote on this electronically. Oh, Supervisor Conrath, did you want? Oh, no, sorry. Okay. Disregard. I'll turn you off here. Okay. Motion passes 23-1. 2021 Resolution 8, advisory resolution to oppose raising the sales tax as proposed in Governor Evers' 21-22 budget. The motion, Supervisor Mary, Supervisor, Shadrin. Sorry. I say Supervisor John. I said Supervisor Joel a while back too. Like, okay. Okay. Any discussion on this one? Supervisor Gallus.
Thank you, Chair. The resolution itself, I don't have issues. The one that I do is the line 34. This resolution, no, I'm sorry, wrong one, line 31. Supervisors at this board hereby oppose all sales tax that applies to all counties. Who are we to advise other counties of what would work for them? Right?
Because we're the most fiscally conservative county in the state, and we want everybody to live within their means. So it's an advisory resolution. It's just saying, listen, we can do it, you can do it. Let's all work together and make it happen. So Supervisor Mahalik.
Thank you. And I said it, I don't know if it was picked up by my friend. Who are we? Like I said, we're Washington County. That's who we are, and I'm proud to be part of that and have it where we can, if you go, it's lead, follow, or get out of the way, and I just as soon lead. On this particular item, of course, whenever you're looking at state taxes being raised, realize we are one of those states that has all three major taxes. You got property tax, you've got income tax, and you've got a sales tax. Other states, which may be looking at raising this or that, actually only have two. You see, that's the one problem that we have is we're taxed no matter which way we face. We have that three-legged stool, and everyone says tax on it. I mean, you go to Texas, you go to Florida, you go to New Hampshire, you've got states that don't have an income tax. Okay, fine. Now, if you're looking at doing something along that line, I can understand. So if Governor Evers or our state legislature wants to get rid of one of those three types of taxes and then come back to us and talk about it, I want to make sure that they can't do, oh, we're only going to raise it a little bit. Well, you have three legs on that stool and you're constantly doing something to have taxes go up. As long as we have all three in place, and we're I think, a very highly taxed state in that regard, we should not allow Pandora's box to be opened and have the governor saying, well, you can always raise this or that, because of course, whenever you do that, spending goes up commensurately, and that's one of the things we'd like to show our fellow 71 counties, that you can live within your means. Thank you.
Supervisor Newman.
Just to help me have a clear understanding of this new tax opportunity, I had a couple questions. My understanding of this is if a community or a county wanted to do this, it's done through referendum. Is that correct?
Correct.
So as a county supporting this anti-tax, it feels as though we're taking that decision away from the voters of the county, other counties or the other communities. Is that's what I feel like when we are asked to support this.
County Exec, would you like to explain who actually is eligible to do this? Because not everyone is eligible, correct?
So the governor's budget allows for an optional sales tax increase. It would have to go to referendum. It would apply to all counties. So specifically line 31, the question about sales tax increase that applies to all counties. This is advocating that not all counties get that option. It doesn't mean that certain counties couldn't get it. If the legislature so chose county XYZ, they wanted to allow for it. But we don't need another blanket sales tax. We tried that, just for the record, back in the 80s, and it was supposed to offset property taxes. And in every county, with almost no exceptions, there are some exceptions, we're not one of them, unfortunately, sales tax was used to simply increase spending. So, yes, I'll sign this once I'm confident you approve it, because taxes never get used to offset other taxes. At least that's not how they're ultimately ever used, including us, unfortunately.
Okay. All right, seeing no further discussion, we'll vote on this electronically. Okay, I'm in. Everybody check, make sure that your yes is green. Or your no is green, I'm sorry. No, so. Okay, motion passes 23-1. I will entertain a motion to convene in closed session pursuant to state statute 1985 1E, deliberating or negotiating the purchase of public properties, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session, specifically to discuss agreements related to future use of Washington County Fair Park, Supervisor Kelling and Supervisor Schultes. Are we going to do it electronically on this, or is it going to be a voice vote? Voice vote? All in favor, signify by saying aye. Aye. Any opposed? Okay, we are in closed session.